is Dr. Corey Moss on Looking Your Best. I wanted to comment today a little bit about scars and scar revision because it's a commonly asked question and one that many patients are concerned of or about. They come in with long existing scars. Many times they've been told there's nothing they can do about the scar or the treatments are worse than the condition. And I'll tell you that most scars I see can be addressed effectively and made to look better. We can't completely erase scars. The body uses the scarring process as a part of wound healing. That's how the body puts or mends the skin back together. With that said, most scars can be improved and some vary dramatically depending on the conditions that we'll talk about. First of all, it's important to understand what makes scars visible, what draws attention to scars. And the first things, and these are not in order of importance, but really are all relevant, is the depth of a scar. If a scar is relatively flat with the skin surface, that doesn't cast shadows into the scar, whereas a scar that's deeper, a pit, a hole, a crease or crevice, will have a natural ambient light which comes from overhead, a shadow cast into it that makes the scar look deeper or look more noticeable. We can improve that by simply revising the scar and bringing those edges back to where they're flat. There's a technique that we use to bring the edges initially to where they're inverted or everted like this, and as they heal, they become nice and flat. So a depression of scar or leveling with the skin is the first important concept. The color of the scar is very important, and this is really a common question where people come in. Typically scars heal lighter than the surrounding skin, irrespective of your skin type. And in some cases, scars can also hyperpigment, which is a reaction to the inflammatory process called post-inflammatory hyperpigmentation or darkening. Both the conditions of lighter than normal skin color and darker than normal skin color can be treated. Certainly easier to treat the darker than normal skin color with treatments like intense pulse light therapy or a number of other treatments that we can use to lighten the post-inflammatory hyperpigmentation or darkening. If the scar is lighter than the surrounding skin, we really have to work to make sure that we're addressing the third condition, and that's the width of the scar. If the scar is more than 1 millimeter wide because it's under tension or it was repaired is not optimally, then we need to make sure the scar is as narrow as it can be, because if a scar is very narrow and still light, it's going to be much less noticeable. In general, if the scar is hypopigmented or lighter than the surrounding skin, we do a lot of things to disguise that scar, including the fourth thing, which is take the direction of the scar and move it in a direction that's more favorable. A scar that travels across an important anatomic boundary like the nasolabial fold or vertically in the forehead is much better if we can change the direction of that scar and make it parallel to the lines of the forehead or parallel to the nasolabial fold or even in the fold in cases where we can move it in those directions. So we really kind of talked in summary about four things. One is the depth of the scar, one is the width of the scar, narrower than or wider than 1 millimeter or so really should be repaired. We've talked about the color of the scar being lighter or darker than the surrounding skin. And then lastly, we've talked about the direction or shape of the scar. And scars then in general can be addressed by treating each or individually one of those things that are causing its noticeability. And that's really the key thing in disguising scars. We can address those features that are applicable to the scar that you have and address them in a way that makes it much less noticeable, and do that in almost any scar that someone has a complaint or concern about. If it's big enough to be noticeable or concerning to you, then it's big enough for us to treat it and make it better. If you have any other questions about scar revisions in general, the treatment of scars, please don't hesitate to visit my blog at drmoss.com or even our website at mossclinic.com. And you're certainly welcome to submit photographs, videos if you want, or ask questions on video, and I'm happy to comment on them. As always, I'm very happy to speak with you and give any answers I can about the questions that you might have about plastic surgery in general or facial plastic surgery in particular. This is Dr. Corey Moss on Looking Your Best.